This is Return to Health with renowned women's health physician, research scientist, and the author of Awakening Athena, Dr. Kenna Stevenson. Now for the next few minutes, join Dr. Stevenson as she explores health issues and answers that can return you to the days of sound medicine and practical strategies for your own health. It's Return to Health. We'd like to welcome you again to Return to Health, and Dr. Kenna Stevenson. How are you doing today?
I'm doing great, Mike. It's good to be here.
In some of our previous programs, we've talked about that mind-body medicine and the connection of the mind to the body. As you and I have been talking before the program today, you had indicated that there were what you called animal-assisted therapies. Well, first of all, before we get into that, what is the mind-body connection?
Well, mind-body medicine is based on the premise that our thoughts, our feelings, our emotions, and our behaviors can affect the activity and functions of cells, tissues, and biological systems. And these effects may promote health or recovery from illness. So
you're saying that that research shows that the mind can have a major effect on how well the body works with all the other medicine that it may have to help it.
Yes, mind-body medicine may be used alone, or it may be used in conjunction with conventional medicine to promote health or disease recovery.
So if I feel good mentally, that helps me actually maybe even be good physically.
Well, there's some research that would support that.
Well, that's interesting, because the other thing is, if I feel good even though I may not be medically good, you would indicate that that could help you to get good, I guess.
Well, that's what the research has revealed, that our immune function, our cardiovascular system, our endocrine system, they all respond favorably to positive experiences or positive emotions.
Okay, so we know that that has a great degree of validity, but what do animals have to do with human health?
Well, animals have a long-standing relationship with humans, and they've been both food and hunting companions, friends, rescuers, transport, and guides for us for centuries. And over half of all American households have at least one pet. And whether we like just watching animals at the zoo or whether we have an animal as a close companion, animals are very strongly linked to the human psyche. If we look at Native American belief systems, animal imagery is used to convey spiritual truths. Most schools will have an animal as a mascot, and those animals reflect certain concepts because animals spark emotional responses, and these responses impact our cardiovascular, our immune, our nervous system. I think one thing animals provide is they offer a non-judgmental acceptance and an unwavering affection to their owners. And we have a couple of phrases as it relates to this animal-human connection. One is, a dog is a man's best friend. And another is, the outside of a horse is good for the inside of a man. I believe that we are hardwired for animal interactions. But over the last 100 years, as Americans have moved away from the farms, moved away from the rural areas, they are interacting with animals much less.
I actually saw a study that said that elderly people that had a pet, like a cat or a dog, actually lived longer.
Yes, pet ownership has been linked to many positive health benefits.
So you have seen studies then that indicate that pet ownership helps your health.
Yes, pet ownership has been linked to numerous health benefits.
I've even seen places where therapeutically people have brought dogs and cats into rest homes or elderly people's homes and let them pet them and hold them, and that helped the health situation too.
Well, yes, let's talk about that a little bit.
Well, okay. So what are examples of animal-assisted therapies? That's an amazing statement. Animal-assisted therapy. You just don't think about that very often. So there is such a thing as an animal-assisted therapy. That's a real concept.
Yes, and doctors in some hospitals can actually write an order for the patient to have an animal visit.
Really, a prescription.
Yes, and I like writing those prescriptions.
So give us some examples of animal-assisted therapies.
Well, we have numerous studies as it relates to hospital visits by animals, and what these show is that receiving a visit from an animal in the hospital has been shown to lower pain scores, lower anxiety scores, lower blood pressure, and improve the mood of patients. A study presented last year at the American Heart Association looked at patients in the intensive care unit. These were patients that were very ill with end-stage heart disease, and they received a 12-minute visit by a human volunteer or a human volunteer and a dog. And outcomes such as their sympathetic responsiveness, their blood pressure, their anxiety scores, something called a pulmonary capillary wedge pressure, which has to do with heart function, all of these parameters were measured during and immediately following the visit. And which group do you think had the most favorable response in the patients?
I'm going to say the one with the dog.
The one with the dog. And my husband, who's an internist, said they should have had one group that was dog only. They had probably gotten even better results.
Yeah, well, that's amazing, though, because, when you go home after a hard day of work, if you have a dog and that dog just goes crazy to see you and just wiggles its tail and goes all around, and it sort of calms you down. So you're saying that interaction has a positive impact on human health.
Yes, and it has been brought into the intensive care unit of hospitals to show a benefit as it relates to patients' recovery and their mood and emotions during the hospitalization. Now, not only do we see a benefit in the hospital to the patients, but we also see that on animal-assisted therapy days, that there's increased morale among the family members and the employees of the hospital because they interact with the animals as well.
I wonder how that is, though. How is it just having a dog there? Of course, the dog is, in the case of a dog, is a very accepting animal. It's a loving animal. It'll lick you with its, but how does that impact the human psyche so positively?
It is an extremely powerful interaction, and I have seen this happen with my patients so many times. I think some of the best prescriptions I write are for the pet to visit the patient or for them to have an animal-assisted therapy visit, and it is just such a booster to them, and I've seen it really brighten their emotions and turn around the course of their illness as it relates to their emotional outlook and wanting to get better. And the patients just cannot wait for the days that the animals visit. Now, not only do we have dogs coming into hospitals, but also we have a program here where the miniature horses go to nursing homes and rehab hospitals.
I hadn't heard that. Miniature horses come in.
Yes, and one thing I think that the female patients in particular really like about the miniature horses is all of the ornaments and the ornate decorations as they braid their hair, their manes, and their tails, just the aesthetic pleasure of seeing that.
I just thought of a business that we can start called Pets with a Purpose, and the whole point is to have animals that we take to hospitals to help people.
Well, and I think there's some myths out there as it relates to animal-assisted therapies. These interactions have been shown to be safe. We have not had any episodes of patients getting infections from the animals. We've not had reports of attacks or even machinery disruption in places such as the intensive care unit. So there's certainly some training involved by the animal owners and handlers as well as the hospital staff. But I think that it is very safe. The one contraindication would be, of course, a patient that has a fear of this type of animal, and that can be very real. For example, if a patient had a childhood trauma of suffering a dog attack, to receive a dog visit in the hospital might have a negative effect as it relates to their stress and pain and cardiovascular system. So you want to be cautious about writing these prescriptions, but the majority of patients do have a favorable response.
We've seen this animal-assisted therapy, but and mostly you've talked about it being in a hospital environment. But what about in a home environment?
We have numerous examples as relates to animal interactions in the household. One interesting study was published a year ago, and they looked at dog owners who were married, and they went into the home and they did 3 stress tests with the owners. So one might be a psychological stressor, one might be an intellectual stressor, one might be a physical stressor. And they did 3 scenarios. One was the patient alone, one was the patient with the spouse, and one was the patient with the dog. And then they measured these stress indicators. And which scenario do you think they had the best performance?
Where the dog was involved.
That's right. It was the patient with the dog. In another study, they took a group of adult patients, both male and female, who had just been diagnosed with high blood pressure. They had borderline hypertension, and they randomized them to 2 groups. One group got a dog adopted from the shelter that had been appropriately trained. The other group was put on a waiting list. They talked with them about some other lifestyle changes, but the biggest intervention was the dog. And they followed their blood pressure over the following months. And guess what? The group that got the dog had the lowest blood pressure, and they did not have to go on medication for their blood pressure.
That is amazing that the interaction with an animal, a pet, a dog, could moderate somebody's health so dramatically.
Well, it absolutely lowered both their systolic and their diastolic blood pressure. And the group that had the lowest blood pressure was the group that was allowed to take their dogs to work. We talked about workplace stress. So having a pet in the workplace is a stress buffer. And, you know, we have this day where you take your child to work, and I'm thinking maybe we should have a take your dog to work day.
Yeah. That is amazing. You know, I could see that. And, you know, it's that kind of out-of-the-box thinking that can affect people in a very positive way.
Well, yes, and so I've certainly utilized pet prescriptions, I think, for outpatient medicine as well as hospital medicine. Another interesting finding that we're seeing as it relates to pet interactions and pet exposure is that children that are exposed to pets in the household early in their life, during the first 2 years of life, have shown in some studies to have less allergies as well as a decreased risk of asthma in adulthood.
That is a very interesting thing, because we're always interested in the things that you can do in the household to help children. So having a pet when a child is young is a good thing.
Well, in some studies, it has been shown to decrease their asthma and allergy risk. And I don't think that the data is strong enough yet for us to say that having a pet in the first 2 years of life prevents asthma, but we are continuing to look at this trend.
Well, I think also that many of the things that we talk about are not always well-established facts, but that doesn't mean they don't work, and that doesn't necessarily mean that they're not going to work. But I have a question. What do your patients say when you say, my prescription for you is to get a dog? I mean, how does that come over? I mean, you have to explain some of that, right?
Well, certainly. And I think most people are receptive to any simple therapy. A lot of people don't want to go on a pill. They want to know, what can I do outside of taking a drug for my health problem? Are there other ways that I can either minimize the illness? And for some types of problems, having a pet may be helpful.
Well, can you give us some more examples of animal-assisted therapies? I mean,
yes, I think there are some examples in special populations. And what we see in children that have movement disorders or learning disorders, that equine assisted therapy has been shown to be of benefit. And this involves, of course, the horseback riding under supervision with appropriate gear. But for these children, they've been able to gain some skills as it relates to both learning and their musculoskeletal systems with this type of intervention. The other special population is the prison population. And Texas Department of Corrections and the Texas Youth Commission, which involves juvenile offenders, have both used animal-assisted therapies. In the Texas Department of Corrections, it involved a program where the prisoners trained guide dogs, and you may have heard of this. In the youth offenders, it was the equine-assisted therapy. For many of these men, their interaction with the horse or the dog was really their first experience at the ability to bond in a nurturing, caring relationship with another creature. And the effect that this interaction had was to enhance their self-esteem, to reduce their stress, and they were also able to acquire some skills as it related to horseback riding or training the guide dogs.
I actually have seen a program on the Discovery Channel, I believe, that showed dogs that were injected into a female prison helped these women come to the place that they could come to kind of a handling of their personal situation. And they came later and showed that like 80% of these women who were given the responsibility to train and take care of a dog, happened to be dogs, were more successful at getting out of prison and staying out of prison. And so that just goes to prove that what you're talking about is absolutely correct.
Yes, and so I think interacting with animals has many benefits. Overall, it does promote our health, and either through pet ownership or becoming a volunteer to help with some of these animal-assisted therapies is a great way for us to use the mind-body medicine in our daily lives and activities.
And so you would say that to use this information, you would apply it in those ways that you just said. You would especially assess, I guess, your situation and then use that particular therapy to help you. Now, here's a great question. If you had an elderly parent that you were caring for, would the encouragement of them to get them a dog or a cat, that could be a good thing?
I've seen it be beneficial. I certainly have, because sometimes a pet can be the catalyst to break through depression, anxiety, grief, physical pain, as well as emotional pain that a human interaction is just not able to penetrate.
I've noticed that when I go home and talk to my dog, that my little dog will just listen. Never offers any suggestion, just keeps listening. And that's a good thing.
That's right. That non-judgmental acceptance, that unwavering affection, the human psyche absolutely responds to that.
Well, I think you've done it again. You've brought to the forefront an issue that, and of course, all of the things that we talk about from time to time may be little in their own particular area, but put together they're powerful, large assistance in helping us to return to health. Dr. Stevenson, thank you so much.
Thanks, and I'd like to invite everyone to visit my website at www.awakeningathena.com. And if you want to share with us a positive experience as it relates to animal-assisted therapy or pet ownership, give us a call at the Return to Health line, 903-668-5971. Thank you for listening.
Thank you, Dr. Stevenson, as we return to health. You've been listening to Dr. Kenna Stevenson and Return to Health. Dr. Stevenson is a highly sought lecturer on a variety of health topics, including women and heart disease, obesity in America, resurrecting the power of touch, media health literacy, gender matters in American healthcare, and many more. Dr. Stevenson's book, Awakening Athena, is available on Amazon.com and at fine book resellers. For health tips or to leave a question for Dr. Stevenson, call 903-668-5971. That's 903-668-5971. Or on the web at www.awakeningathena.com. Join us next time as Dr. Stevenson shows us the way to return to health.